Today, we are reporting 920 cases of COVID-19 in our community, an increase of 4 cases from yesterday. One of the 4 new cases is a worker in the agri-farm sector. 490 cases are resolved, 14 people are in hospital. 18% of our cases are between the ages of 20 and 29 years, 17% are between the ages of 30 and 39, and 17% of our cases are 80 years and older. 47% of our cases are male and 52% are female, with 1% unknown. Our community has lost a total of 63 people to COVID. 47 deaths have occurred among residents in long-term care and retirement homes. 2 long-term care and retirement homes are currently in COVID-19 outbreak. Testing is available for symptomatic people, those who have at least 1 symptom of COVID-19, even mild symptoms, and testing is available for asymptomatic people based on level of risk, including people who are concerned that they have been exposed to COVID-19, including people who are contacts of a confirmed case or may have been exposed to a confirmed case or a suspected case of COVID-19. This testing is also available for asymptomatic people who are at risk of exposure due to their employment. This includes essential workers such as healthcare workers, grocery store employees, and people working in the food processing plants. No one who is symptomatic or who is concerned that they have been exposed to COVID-19 will be declined a test at an assessment center. Common symptoms include fever, a new or worsening cough, and shortness of breath. However, other symptoms may be present, such as a sore throat, difficulty swallowing, unexplained fatigue, an increase in falls, nausea, vomiting, chills, and headaches. To access a local healthcare provider, walk-in clinic, or virtual health assessment, please visit ehealthwindsoressex.ca. Windsor-Essex has 2 COVID-19 assessment centers, Erie Shores Healthcare in Leamington and Windsor Regional Hospital Olette Campus. Also, please note that SOHAC, the Southwest Ontario Aboriginal Health Access Centre in Windsor, offers testing for First Nations, Métis, and Inuit people and their families. Please continue to visit our website at WECHU.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates regarding COVID-19.
Hi, good morning. As part of the Stage 1 plan to reopen the province, the Ministry of Health released guidance yesterday evening for the health sector to restart services. In March, the Ministry released a directive to the health sector to cease all non-essential and elective services. This directive has been amended, allowing healthcare providers to gradually reintroduce these services. What this means for the public is the services that medical care you have put on hold or been waiting will soon be available to you again. The ministry guidance provided to the healthcare providers need to be considered in conjunction with the direction provided by the various regulatory authorities and public health. The guidance document outlines actions that must be in place for enhanced service delivery and protection from disease exposure and transmission. These include risk assessment. All healthcare providers need to complete an organizational and point-of-care risk assessment to reduce the risk of COVID-19 infection. Implement a hierarchy of hazard control, starting with the elimination and substitution, for example, using telemedicine versus an in-person visits. Engineering and system control measures, for example, barriers for reception, administrative control measures, screening of patients for COVID-19. Testing. Healthcare providers should refer positive screened patients for testing. Healthcare providers that do have the ability and are equipped and trained to conduct the test can do that on site as well. This is an important step for our community. Many services have been limited or completely closed to the public over the past few months. It will take time for the healthcare providers to put all of those necessary controls in place to reintroduce these services. As well, there will be need to considerable collaboration and communication with residents and support services to ensure that patients and clients understand the rules and limitations around services going forward. The way we engage with our health services and health system will be very different than we are used to. I also want to highlight that the health unit is here to work with the local health sector to provide training and further guidance as they restart their services. And as I have mentioned previously, we are anxious to see our primary care provider providing the support for COVID-19, supporting their population with their primary care needs, including immunizations and any other urgent need of their clients. As well, this morning, the provincial government announced the extension of orders under the Emergency Management and Civil Protection Act. These orders were set to expire at the end of this week and have been extended to June 9th. For a full list of orders in effect, residents can visit the Ontario government's website. Of particular note, the extension applies to social gatherings, which will continue to be in place for no more than 5 persons, and the continued closure of outdoor playgrounds, play structures and equipment, outdoor water facilities, restaurants and bars, except takeout, and hair salons and barbers. I will end with today's question from our Facebook Live viewer. The question relates to getting together with a family member that works in Michigan. Michigan, and in particular the city of Detroit, continue to pose a risk for COVID-19 transmission with their high case counts. My advice continues to be that anyone working in Michigan continue to practice work-home self-isolation. This means going to work, returning home, and avoid small gatherings or interaction with people outside the home. Thank you.
We'll now take questions from the media. We'll start with Blackburn.
Just as you're introducing, or as healthcare providers are introducing some, or reintroducing some services, are there any services at the health unit that will start being offered again?
So Health Unit, our dental program, we will be starting that dental program again. In terms of direct client services, we have our sexual health clinic that we are also we still provided services to even throughout the pandemic on anyone who was needing that kind of care. We're trying to move many of these services if they were not non-urgent. But to begin with, our dental program will be starting soon, and we'll share the details.
Any questions from CTV?
I guess I'll ask you this one. It's kind of a fluff ball, but yesterday I ran into to Steve Bell. Didn't even recognize him, right? So when you're talking about the extension going to June 9th, he needs a haircut, like really bad. So I hear you talking about the extension again. So I'm wondering, they're doing it in the States. So why the hesitation to do that here in Canada? Do you have any thoughts on that?
So what I can say is when we're looking about these type of services, it does require less than 2 meters distance to come and provide the service. And then having the ability to provide the service with appropriate personal protective equipment to save the person who is providing the service as well as person who is receiving the service. So I think those measures need to be in place. If these measures through the supply of PPE or engineering control or some kind of an administrative control can happen, I think that will be the best thing. And recognizing that not all of these service providers are equipped to provide this type of services immediately, but I think it's about time that it should be coming soon. So even if you are a business owner and operator, you must be thinking about innovative ways using the same guidelines in terms of how you would protect the person accessing your services, just like we provide advice to the primary care provider that do the phone screening. So can it be only appointment based? So we'll have to look at that. We can also think about, when you're bringing in someone, how can you reduce the likelihood of them coming in contact with at the waiting area where everyone is sitting Do they need to wait? Can they just come in, get the service, get out, and instead of sitting in that area? When they are sitting in that chair or getting the service, how far apart they are with other providers or other people? And if the providers are, do they need any kind of personal protective equipment to protect them from coming in contact with the person, or the person need some kind of PPE depending on the type of service that they're getting? So I think those are the things that we need to look at, and the business need to be considering that. And as a broader Emergency Management and Civil Protection Act, so I think when we're talking about all these businesses and having those restrictions in place, so it is in place until it's been lifted by the province.
He's going to look like Santa Claus by next week, so anyway, okay.
Any questions from AM 800?
Yes, Bob, we didn't recognize Beller either. Excellent. Just a couple of questions regarding the testing, because, obviously there's been a ton more people being tested. We're assuming, that they're asymptomatic just because of the testing being opened up. So I've seen some chitter chatter on Facebook about some of the results not being available online. People are being told to check online, but then some people were talking about going online and it saying that not all labs report to the online system. Can you clarify that?
So I think I clarified that a few times, that when all of these people are getting their tests done, our regional lab is the London lab. They process most of these specimens, but depending on the number of specimens that they're receiving in any given day, sometimes they need to ship it out to other labs in the province to meet the capacity, as we know that whatever is the lab capacity. Some of these labs are not on the OLIS system. So OLIS is the system that we use to access the result from these lab testing, and it could be delayed for a day or two. So there are some of the issues on that side, but most of the time, even if it's delayed, it is available within like a short period of time. But a positive test, they get pretty quickly turn around and then are notified to public health, in addition to just posting on the OLIS database.
Okay, and then also in terms of health unit contact, is the health unit contacting every single person who was tested to tell them about their results, regardless of whether it was positive or negative?
Not anymore. We are doing only the positives now, given the number of negatives are increasing. So we are asking people to use the online portal to check their results. But we are definitely reaching out to all the positive cases, that results that we are receiving.
Okay.
Any questions from Windsor?
Yes. Yesterday you issued the order to migrant workers and to agri-farms, restricting workers from working in more than one facility. Why was that issued now? Was that in response to the 33 cases reported on Monday and the 2 yesterday? And why was this not considered sooner, perhaps?
Again, when you're asking any of these businesses or even any individual to put restrictions or enforcing them to do something, there has to be some kind of a risk assessment to justify why you're imposing some restrictions. I cannot enforce any restriction on people walking down the street unless I have evidence to believe that if they're walking down the street, they are at a risk. They are posing a risk to the community. So I think to answer your question, why it was not considered is because of the risk assessment. Based on the risk, we recognize that these farm operations are complex operation. It requires multiple level of government, multiple legislations, and the way even each of these businesses are operated. And given what we are finding with our case and contact management, there are some risks that we are identifying, which we are trying to manage and mitigate. And one of the risks that we identified, just like the long-term care homes, people, when they're restricted to one workplace, the likelihood of them spreading to another workplace is low. Some of the farm owners have multiple locations. So instead of an employee who could be infected, working in one farm and then going to another farm and then going to another farm and potentially exposing other people. We want to restrict that and want to make sure that we are formalizing all those details and get all the information that we need. So if we are doing any kind of investigation, we have all that information of who was in that particular farm on that given day, and the comfort to know that they were not in anywhere else. It allows us to do better case and contact management. So that was the intention behind it, and it was based on the risk. If there's any other type of risks we identify that could help with us to manage and do a better case and contact management, we will do it.
Any questions from the Windsor Star?
Yes, Doug Ford mentioned on Monday that he wants people in Ontario's hotspots to be tested, meaning very specific neighborhoods that are hit hardest. But we don't have a postal code breakdown, and nowhere does, of what places might be hit hardest. Do we have neighborhood hotspots, and is that the kind of information you might share so to encourage people without symptoms to go to an assessment center?
I don't think that having a breakdown by these postal code would make sense, especially for the region like ours. Maybe a city as big as Toronto, it may make sense. But for the city of our size or the municipalities of our size, I don't think that it would make sense. It can possibly give a false sense of expectation to people that they are safe if they are not in that neighborhood. We do provide a breakdown of cases based on the municipality, and no surprises there. Even if you would like to find a hotspot in the region, it could be in the city of Windsor because we just have more population, and it's all a function of every time we're talking about infectious disease, it's all the function of number of people in any given area. The more people you have, the more cases you will have, and the more hotspots you can identify. So we do have those breakdown by municipalities, and that's why we have 2 assessment centers in the region, just to meet the needs of these pockets of population and serve the needs of the community.
And then separately, we've heard that it's possible a significant number of workers at Hybrid Canco have tested positive for COVID-19. Can you comment on that? Is there a concern about a large number of those workers there being positive?
I cannot comment on that on any specific business. I'm not aware of any specific business outside of what we have already reported, or if any businesses are getting their employees tested, that's their decision. If we get a positive, or if we get positive cases from any other businesses or any risks that we identify in any of the businesses, we will act up on it. Right now, I don't have any information on any of the business in particular that have a high number of cases or a cluster of case that requires further public health action. We may see the numbers. I don't know. I am not aware, at least at this point.
Okay, thank you.
Any questions from CBC?
Yes, good morning. I know we're getting to the end of the first heat wave at least. The city so far has offered water bottles and the aquatic center. What other things should the city be doing to help people cool down?
So if you're looking at some of these previously offered services in terms of how these facilities support these type of heat waves by opening up cooling centers, by opening up some of the facilities where people can cool down themselves in an air-conditioned environment. Unfortunately, many of these services and facilities are closed because of COVID. So there's limited options available, and I'm not aware of what other options that city can use. I think that's the city's plan, and you can redirect your question to them. But what I can imagine is being prepared and being aware. And most of the time, if people are not going outside, it's just stay in the shades, drink plenty of water, and just basically take care of yourself.
Okay, and I know you were quoted today about how the Ontario government's kind of opening up things, not putting numbers associated with the stages that they plan to allow things to reopen. What kind of things do you want to see maybe have health units have more control over before things begin opening up further?
So I think one of the critical piece that we are looking for is obviously the number of cases that we are seeing in each of the community and what's the expected number of cases, and make a comparison that if there's an anomaly, day-to-day variation exists pretty much everywhere. So I'm not concerned about those day-to-day variation, but I'm more concerned about a trend or something which is above the expected normal. So some of the things that we talk about is the 7-day moving average or 3-day moving average, or a combination of both, to see how day-to-day fluctuation in these number of cases are impacting. On the other note, we also need to look at what is happening from a health system perspective, and for example, the emergency department visits, the number of hospitalization, ICU bed utilization, and how these services are being provided right now. Other thing that we need to look at is in terms of the availability and supplies of PPE, the service providers that exist in the community, the number of people who are getting those tested and done. So we would be looking at a range of indicators to help guide us with our decision making, and I'm looking forward to get all those details before we move forward.
Do you feel like you have the control that you need to make sure everything opens safely?
I don't understand your question, like in terms of the control. Some of these decisions are coming from the province, and I guess if it's entirely a local decision, obviously we will have to look at the local situation and make that local assessment to ensure that we are ready and we are providing some of these services. But mind you, there are some things that that is very, very local, and we'll have to have that conversation once we get to that stage, and we'll have to continuously revisit those decisions. Doesn't mean that if the province or if the entire community is opened up, it will stay open. We'll have to take a look at it, depending on what we are seeing in the community, and if there is a need to maybe ease off further restrictions or maybe put more stricter restrictions. So we will have to look at that. I cannot predict what the future lies, but right now, where we are, we need to look at how these reopening first stage or the stage 1 is impacting the communities. So now the businesses are opened up, and we'll see the results in maybe the next week or the week after. That will be a good indication to see that one decision, how it impacted the communities, in particular our communities. That would be my concern. And then moving forward, if more easing of these measures are happening, how it will impact my community. And if there's any risk to my community that we can mitigate by taking some proactive measures locally, we'll have to have that conversation, and everyone involved in those decisions, including the municipalities and the leadership, will have to have that conversation.
Thank you.
Any further questions from Blackburn?
Yes, just in regards to the report that came out yesterday about long-term care homes in the GTA area. I know you've been visiting a lot of long-term care homes in the region. It's not your job to inspect them, but would you say people need to be concerned about long-term care homes in our region?
So if I'm understanding correctly, your question is about the long-term care homes, and if those concerns are something that I share the same concern. Is that the question? Well, we know that, again, some of these problems are systematic problems that have been there for quite some time. And right now, I think it's every time, like somebody told me that these type of pandemics, it's a good reflection on how the system is and how everyone's behavior works in these type of crisis situation. So the pandemic has really opened up our eyes in terms of how, what are the challenges in these institutions. And I'm really hoping that once it's all done, we'll have a good learning of from this exercise, and we'll have a stronger system in place to ensure the safety and well-being of our most vulnerable population. And we have a good system in place right now. It is a patch-up work that we have done to manage the outbreak and to provide the support that these facilities need. And again, it's no fault of any of the home or any of the employees or people working in that facility. I think it's a big systematic failure, and we'll have to have that review to find what will work best and how we can avoid and prevent these things from happening in the future.
So you don't think it's a reflection on any of the homes where there were a lot more cases than, say, some of the other homes?
I don't think that would be a reflection on any particular home, but I think, again, if you have a system that is not built or designed to answer or address these issues, a failure here and there could basically doesn't mean anything, I think, unless we fix the system. Even in the community, if we are having more cases, does that mean that Windsor-Essex have something really bad happening? We have to look at some of the other consideration that why Windsor and Essex County are having more cases. Because of our proximity to our border, because of our proximity to different type of businesses and services that we have. So we have to look into various factors. It doesn't necessarily mean that one home in particular is bad or good, or the employees working in one facility is bad or good. So I think we really need to talk about a system approach and what we need to do as a system to support them. I think that's the most important thing. You cannot expect anything unless you're providing the right kind of support that these facilities, these employers, these employees need. So we'll have to have a good look at what is needed and how we can best support them and protect our most vulnerable population.
Okay. And just, I noticed that Heron Terrace is still on the outbreak list. Are they still having new cases within the home, or is it just with those that are in the field hospital?
So by definition, any facility, if they have a new case, either in a staff or a resident, in the last 14 days, they will continue to be in the outbreak. And unless they they are free from any new case, whether in the residence or in the home, they will not come out of the outbreak. So if you use that definition, any of the facility that is currently in outbreak, that means they are having cases, and that's why they're still in outbreak.
Any further questions from CTV?
Yeah, just you mentioned the 3-day moving average and how you extrapolate data from that. So a week ago, there were 11 new cases. The last 3 days outside of the bump from the agri-farms, it's been relatively low. 3 one day, I think it was, and then 4 today. So what's your takeaway out of that?
So I think when we share our epi summary, we've been very pleased with the number of cases that we are seeing. Not that we want to see the cases, but at least some kind of a stability that was coming into those cases. On an average, we were seeing between 8 to 12 cases a day, which was pretty much stable for 3 to 4 weeks or longer. And these type of, unusual number of cases that we have seen in the last couple of days, it definitely heightens the concerns. But if you look at the broader picture in terms of moving average, it may not necessarily be a bad thing. And even when people are talking about these particular industry or agri industry that was having more cases, that is a problem. That may not necessarily be the case, because it could be something that we are being proactive and we are monitoring what we should do in terms of case and contact management, because most of these cases were contacts of the original cases. So it is not necessarily a bad thing to have all these cases, because if we can mobilize our team or mobilize our resources to control it in the first place, finding these cases can be a good thing, because now we have prevented further spread. So we'll have to make that decision. It's not just a number that we should be looking at. I think we need to look at all the bigger pictures, whether these are community cases, whether these are contexts of the initial cases, and what these cases looks like, and do we have a better system to address those answers. So even from a public health capacity perspective, we have been asked to do the case and contact management with at least more than 90% within 24 hours of a confirmed case reported to us. Our health unit target has been always, since we started reporting, it's been 100%. So we are doing all that pieces, and we'll continue to do that. And as we'll get the cases, we'll be in a much better position to act immediately and take control and prevent further spread.
So I guess to extend that, obviously the average is dropping down outside of the agri, so are you encouraged? Like, you know, I know you've been looking for that golden goose egg, so do you sense that zero might pop up at some point in the near future?
I really hope that it happens, and it happens sooner. That's the hope. But I think it does require support from every one of us. It cannot be just my wish or desire that this happens. If we are all acting the way we should, we can get there. And I think that's what we want. And not only for one day, it has to be consistent. Many of the things that we were talking about, it takes some time to change behaviors, but with constant messaging and the right messaging, not following the misinformation, we can get there. And I think that's where we should be as the community, and even not only just for today, but moving forward. If we meet that, we will be in a much better position as a community, and we should be in a position where we can talk about reopening, getting back to the life that we used to. Not entirely how we used to, but at least with some variation of it, to be respectful, to be responsible, and also able to limit the spread of the disease.
Any further questions from AM 800? Windsor-Essex?
Yeah, just a question about the time frame for test results. Given that the assessment, or given that testing was open up to anyone to go to the assessment center as of Monday, if someone went to get tested on Monday, when can they expect to see their results? You had said 48 hours before, so would that mean today?
Well, it's a moving target, as we know, and we can't really say that when they should expect. We have received test results back in 24 hours, sometimes 48 hours, and sometimes even in a week time. So I think it really depends on the lab and where they're getting the results. Their goal is also to send the results back to us within the first 24 hours. But mind you, when they're getting more of these tests, they'll have to have a prioritization. They'll have to identify that who need the answers quickly, and that includes people with symptoms, people who are hospitalized, people who are in ICU, people in long-term care home, people who work in the essential businesses who are symptomatic, and or any other criteria based on the medical needs of these individuals. Anyone who is asymptomatic probably would be below the criteria of all those other people group that I mentioned. So I think it really depends on how many results that how many specimens that the lab is getting every day, and processing it accordingly based on the priority or based on their capacity.